All right. Hello. My name is Pam Veale. I'm a developmental pediatrician at the Alberta Children's Hospital. Welcome to this session about children with complex congenital heart disease and the implications for early childhood development. This presentation was actually presented initially as a parent information session in September of 2024, and we're recording it today on January 10th, 2025. So, we will be discussing two areas today. The first area is to talk about developmental delay, specifically what we mean by this term, and why it is important for children who have complex congenital heart disease. I will really try to emphasize factors and things that are in your control as parents. We call these modifiable, and they fall into the general category of what should you do. When you read the literature or the research about children's development, there are some factors that can't be controlled. The child comes with them or they have already happened, such as a medical complication. And these non modifiable factors are useful to inform some of the things that we do. For example, which children should be followed more closely, but parents often find it very hard just to go through a list of challenges and risk factors about things that they can't do anything about. So, for that reason, I hope this session is quite practical for you. And I've tried to include a number of links to information that you may wish to access, as well as ways to find support for your child. So, I am a developmental pediatrician, and over the years, I have done a few sessions for the cardiology parent groups. Initially, it was Dr. Joyce Harder who approached me. More recently, it was Marcia Vasserman, who is a psychologist who works with the cardiology clinic. And I have a specific interest in children who have complex medical and genetic conditions with resulting implications for child development. And I first got interested in the group of patients with complex congenital heart disease a number of years ago. And one of the first children that got me really engaged into the topic was a school age child who had a history of complex congenital heart disease. He'd had multiple surgeries. Even though he was relatively stable, he was still on medication. He had some exercise limitations and he was referred to me for school difficulties. At that point, he was behind academically, he was being teased, he didn't like school, he had some behavioral symptoms. And when I saw him, it was not clear that it was all related to his heart. And over a course of probably a year, we were able to get him to a point where he was doing well. Now, he was referred to me in a very similar way to many children that I see, but the circumstances really prompted me to look into the implications of his heart condition on child development. And over time, we've had several conversations and various evolutions in our understanding. But realistically, for this little boy, he had been sick. Once he was being supported appropriately, he could talk about that. He could indicate at my school, they helped me to learn better. His parents felt terrible and had assumed that there was nothing we could do because of his heart. Now, his usual physician, when we went on and diagnosed his learning disorder, was not surprised. And that was very interesting for me to sort of see the different perspectives there. So that little boy really got me interested in looking at what we can really understand for children with these complex conditions. What advice can we really give, and when should we give it? Now, today's presentation, I am talking about tiny children under age 5. And we talk about development and learning in childhood in a number of different ways. We think about groups of children and how their progress compares. And you see that as parents in a number of different ways. Sometimes that's record the activities in a baby book or record. When did your child say her first word? When were his first steps? Sometimes we find website lists that ask, is your child doing whatever by age whatever? But there's other opportunities to think about that in daily activities, such as in playgroups with other children's, comments from relatives or friends. And then there's a lot of discussion that happens around school readiness. Is my child ready for school? Later on, we start to think about report cards for academic progress, for interviews with teachers. And there's a lot of these different kinds of ways that we interact. Interact. There's a lot of these different kinds of ways that we interact and think about child development. But what happens if they don't apply to your child? Now, many parents of children with severe and chronic illness, they find that these lists, these expectations, these discussions are less relevant. They feel that review of development and learning is really difficult in the context of more pressing issues. And that is completely appropriate. But it doesn't mean we ignore their development or avoid early intervention approaches. So on this slide, you see a few different things that are these reasons that these factors, these domains of development, these lists of progress don't seem to always apply. So if your child is sick, just had surgery, lost the opportunity to do some usual early childhood activities, sometimes you know that your child has an underlying medical condition that is associated with developmental problems. And a lot of families really feel that their young children have been through a lot and are doing really well. So, why do we assess development? What are we hoping to learn? What will we do with the information? Well, the main things we hope to do is to confirm that we have expected progression of learning and development in different areas. That is reassuring. That helps us to anticipate what is coming next. That's what we are hoping to do. But actually, we often identify atypical progression. Child is not progressing and learning and developing skills as expected. And that will lead us medically to diagnoses sometimes, and it will certainly inform our management. And we're interested in this because delays in development are common. And early intervention for developmental delays improves the eventual outcome. If you remember one thing from my presentation, it's that early intervention is important. We also know that children with chronic illness, including congenital heart disease, have higher rates of development, learning, and behavioral disorders compared to other groups of children. Now, I'll talk about this a little bit more in upcoming slides, but it's approximately 40% of children with complex congenital heart disease will have early development problems that are apparent in that first 5 years. We're not always fantastic at identifying these delays. So I hope to raise your awareness as parents because parent concerns are important and may help us to identify children who are not following expected trajectories. In the under age 5, we typically are thinking about 3 big areas of early childhood development. The first area is motor skills, divided into gross motor or large movements, and then fine motor, which is mainly hand use, but also involves some oral motor skills. Now, delays in motor skills are most obvious to parents early. And there are some really quite nice objective milestones to ask about, and delays are relatively apparent in groups of children. So, for example, if your child is not sitting and other children of that age are, you can notice that. Is your child late to walk? You will notice that. Typically, language milestones are identified as being delayed somewhere in the first to second year of child's communication. Now, there are earlier milestones, but most families start to become worried when their children are not starting to speak as expected. There's other elements to communication beyond how many words does your child say, but also how that communication is happening. Does the child use nonverbal gestures? Are they understanding spoken language and so on? The social development is harder to define in specific milestones, but tends to involve behavior, play, and interpersonal relationships. So, when we think about milestones, we are talking about these different categories. Later on into school age, we also start to think a little more about some of the academic or more clearly cognitive milestones. But in the 0 to 5 group, these are going to be our main areas that you're going to find on checklists. And they're the main things that you are able to follow along as parents. Our main questions is the progress proceeding as expected in terms of both the order of skill acquisition and the timing? And if it is not proceeding as expected, is it a general delay? So there are delays in all of those areas I just mentioned. Is there a single or a primary area of delay? Is there patterns of development that we can identify for diagnostic purposes? And is there regression? And you'll notice regression is in red on this slide here. And that is because if there is loss of skills, you must have a medical assessment completed because that is often an indication of a significant medical problem. In addition to thinking about the order and the timing of skills, we also want to think about some of the simple reasons why we might see delays, and that's why it's important to think about screening for hearing and vision problems. So, when I use the term developmental delay, I am really talking about a trajectory that looks like this. You can see here for the trajectory for this little child here, the child is gaining skills. The child is making progress. Let's say the child has started to roll over. Now the child is sitting independently and now they've started to walk. And that is progress at the child's pace. But where the difference is that other children at the same age are progressing faster. Okay. So this person down here, if that trajectory, if that's the only child that you ever know, that you ever see, that you ever interact with, you may not be terribly concerned because that child is progressing. But it's in that group of comparison to other children, particularly the older you get, that we see this gap in skills. So, for example, this child here at 18 months may not yet be walking, whereas the majority of children here at 18 months will be walking, and that is something that is apparent. In some of the more formal statements, we define developmental delay and that a child is not developing or achieving skills according to expected time frames. Okay. So it's that idea that it's coming slower. And there's reasons that we may see this more often in patients who have complex congenital heart disease. So here's a few examples of reasons that children might have more frequent delays in development in these groups. And I'm going to go on and give you a more specific example in each of these areas. So, some children, their congenital heart problem is actually part of a bigger condition, perhaps a genetic syndrome, that is known to be associated with development or learning problems. Sometimes we see actual medical complications which result in a development or learning problems, potentially something like a brain injury. Sometimes we think, the child has been quite ill and has been unable to participate in usual learning opportunities. And sometimes you just have two different things going on. So here's some examples to give you an idea of what I mean by these. So, in the first case, um, if we think about a little girl who has a genetic syndrome and her heart condition is identified in infancy, and when the parents read about Turner syndrome and learn that there is a higher rate of learning disability, that's kind of interesting information. But right now, this little person is only 2 years old and she is doing very well. And she has not yet started to use any words. So there's two elements in this example. One is that she has a clear risk factor. She has a genetic condition with a fairly well described outcome for learning, and we can make specific recommendations for timing a formal assessment when the child reaches appropriate ages. But right now, she has developmental delay. She is not speaking at age 2, and she should be referred for early intervention. Another example might be a child who has had some medical complications that may result in development or learning problems. So, for example, a child who required open heart surgery as a newborn and had a really complicated course with a long recovery period. The family was told of a suspected brain injury at the time. Now, he is 4 years old right now and he is doing great. He is medically stable, he is attending preschool, and he is noticed to be kind of hyper compared with other children. So there's several things, risk factors in this story, and he has obviously done very, very well given a rocky course. And probably his caregivers have relaxed a bit and are feeling that the worst is behind them. To be honest, the family may not even be too concerned that he is hyper. They might actually be thrilled that he is well enough to be active. But one of the things we know is that the frontal lobes of the brain are more sensitive to injury, and this may manifest as ADHD or learning disabilities, which will become clearer as he reaches school age. And in fact, ADHD may be present in 40 to 50% of children with this kind of complex history. This little boy is still young and has lots of time to mature, but probably he should be watched quite closely in the next few years. The next example, child that has been ill and unable to participate in usual learning opportunities. So, for example, child who has cyanotic heart disease who missed a total of 8 months of school over the past 2 years, which happened to fall in his kindergarten and grade 1 years. He is currently 7 years old, and parents wonder if he should be held back because he is not reading yet. And so this one is complex. There's some medical risks, there's some opportunity factors, and he'll require some careful review in order to answer this parent question. And then finally, an example, there's a child who's had an uncomplicated repair of a large ventricle septal defect when she was 9 months old. She is now 9 years old and had a school assessment that reveals a learning disability. Her father was also in a special education program in school. And I raise this because not everything is going to be blamed on heart surgery. Not everybody has complications. Sometimes there really can be just two things going on. So that brings me to talk about what at risk means. When I say children with complex congenital heart disease are at risk for developmental delay, what does that mean? It means something is more common in that particular group. but it's not a guarantee that the problem will occur. It is a reason to look closer than usual and to act if the symptoms are apparent. Remember, I spoke about early intervention earlier. And at risk of what? So, this group is at risk for developmental delay in general. And in that young age group, what we see most frequently are motor delays and language delays. We know that additionally later on, we may identify a learning problem for about 20%. And as I mentioned, there is a higher risk of attention deficit hyperactivity disorder. Now, I'm going to shift and talk a little bit technical for a moment about some elements that are in our medical literature. First of all, I've been talking so far in general terms about kind of all patients, but there is a group, even within the cardiology patient group, that is at higher risk for delays. And that would be children who have cyanotic heart disease, who require complex open heart surgery as newborn infants, or who have combination of medical factors along with their congenital heart disease. And I've put some examples up there on the slide. This is not rocket science. These are ill children. These are children who are at higher risk for medical complications, who come with biologic factors that may affect their development and learning. And it's essential for this group that we prioritize the heart. I do need to comment that a caution when we look at our medical information is that our surgical and medical care has changed over time. And so the outcomes we might look at from past decades are not necessarily relevant for current populations. So we have to be a little bit careful with that. But overall, the medical literature is going to tell us the sicker the child, the more complex their medical condition, the more closely we need to look at their learning and development. Having said that, what do we see clinically? Well, we see a little bit different than what I was just talking about. We sometimes see parent distress with another problem. Often parents are trying to move on after quite a difficult time, and their child's progress, developmental delay, school readiness is not a big priority at all times through their life. This priorities comes back to what I was speaking about earlier. Sometimes the timeline for well children does not fit, and we may need to think about our realistic expectations without forgetting that early intervention is helpful. We really see that families trust their primary people. They trust the cardiology nurses and physicians. They trust their primary physicians in the community. And even though I might be a specialist in the area, families also want to check in with the individuals who have known them over time. And it is very appropriate to do that. If you have concerns, please start by talking with the caregivers who know your child best. And we also know that everybody's a little bit different. And some families have a lot of concern about development and learning and recognize issues early. Others have less experience with young children, perhaps, or less concern with their child's progress. I'm showing you this publication. So, this is a screenshot taken from an article that is quite technical. It recommends how we would evaluate for development in children from 0 to 5, talks about recommendations for specific developmental assessment tools. And it's recommendations from this cardiac neurodevelopmental outcome collaborative, um, really high powered group, mostly from the United States. And it's quite a technical article. But I want to show you two highlighted areas from the preamble that point out common pitfalls that we see. The first is that there is a common false belief that a child who is showing developmental concerns will catch up with their peers and that it is beneficial to wait and see. The idea of catch up without doing anything, without making specific strategies or doing specific interventions really isn't an accurate concept. And one of the components to this is highlighted up here that speaks to there's often a relief following a child's difficult medical course, and they may be encouraged by people who are really well intended and say, oh, they lost time, they just need that more time to get back on track developmentally. If you think back though to my picture of the different trajectories with the arrow of progress for the child with delays, the rest of the group is going faster. So, in order to really catch up to where the peer group is, we're talking about an accelerated course. And that may or may not be realistic. So, what do I want you to do? If you think your child is at risk for developmental delays, if you identify areas of concern, I want you to talk to your primary physician about that. I want you to think about using a screening or tracking tool and to really think about with your physician, is this an expected trajectory? If there are delays present, has hearing and vision been screened? Even if the child appears to hear, if they have speech delay, we're going to formally test the hearing. Even if the child appears to have good vision, we're going to assess the vision if there's motor concerns. We are going to think about early intervention, and in a few slides, I'll show you how to access that. And then we're going to think about support as the child gets ready to enter into preschool years. If you don't know what is expected, if you don't know where to look to determine what that trajectory expectation might be for your child, I've put some websites here on the slide. One is local, it's through Alberta Health. The second one is the Canadian Pediatric Society, it's the Caring for Kids Parent Information site. And the third is the Center for Disease Control in the United States. All three of those sites list milestones in the different domains I spoke about earlier. And you can take a look at that and see where the expectations are for your child's age. And if you do think your child falls into that not progressing as expected trajectory, then we want to think about early intervention. Now, this is early intervention, how to access it in the community in Alberta. So, not for hospitalized children. This is for well children who have been typically discharged from hospital. The usual first starting point for developmental delays would be through something called pediatric community rehabilitation. This is an Alberta Health Services program. And typically, as the first starting point, may be the route to access a speech pathologist for circumstances of speech and language delay, or an occupational therapist, physiotherapist for case of motor delay, to really do that additional assessment and provide more specific recommendations. Now, parents may call directly to initiate that, or the families may be referred by their physicians. In Alberta, there is a program for preschool support that really covers the 3 to 5 year old age range primarily. It's a little bit longer technically in the criteria. And this is support for children who have severe delays. So there is a severity criteria, and application is done through the child's preschool provider. And the final one to take a look at is family support for children with disabilities, which is exactly what it sounds like. And many families will be made aware of these of family support for children with disabilities around medical needs or sometimes around basic or transportational needs. But Family Support for Children with Disabilities program also supports funding for children who have developmental needs. The family applies directly for this program, but medical documentation is required. So, those are three different avenues for early intervention programs, again, in Alberta. But I would advise families to start, if you have concerns, speak to your primary care provider. I'm going to take a little side topic here for a moment, and I'm going to talk about screen time because as a developmental pediatrician, I feel that I must do this anytime I am speaking with a parent group. I really encourage all parents to go to these links and read the statements from the Canadian Pediatric Society regarding screen time use in young children. They're very well done and balanced. There are four components to the recommendations around screen time. One of the recommendation is to actually minimize and limit the amount of screen time that young children have. It further goes on and thinks and asks you to think mindfully about how you are using screens with children. So, thinking about the kinds of things they are doing on the screen, watching together with children, thinking about educational programming, and so on. The third element is for families to model healthy screen use. And the fourth is to do some risk prevention to mitigate some of the risks for children being exposed to inappropriate material online. Now, in these statements, hospitalized children are not explicitly discussed. And it may be very appropriate to permit your child to watch a movie on a tablet during long wait times, or if you're isolated in a hospital room for a period of time, or there's a need for distraction during a procedure. But I want to raise this with you because once the child is well, and not in hospital, and those particular circumstances don't apply, we really don't want those to become lifelong habits. And every single family I speak about now, and every single family that I meet in clinic, needs to speak and think carefully about screen use because it is really pervasive. Our current recommendations for young children is that children under age 2 do not have screen time, and that children aged 2 to 5 have less than 1 hour per day. And you'll immediately think, well, how can that possibly apply when my child is sick or hospitalized? I agree. But when they are well, I really, really encourage you to address screen use and look at other healthy, appropriate childhood play, physical activity, and opportunities for learning. Now, I'm going to take the last few minutes and think about a few more specifics. And the specifics are for the group of families that really they want to know the details. I've been talking in general terms about development. I've given you some resources to take a look at for both expectations, how to seek support, but some families they just want to know more. So, for those families, I would recommend this summary article is probably a really nice, detailed description of what I'm talking about. So, this was published in February of 2024, and they're defining this group of children with complex congenital heart disease as um, children that have conditions necessitating cardiac surgery within the first year of life in order to survive. And this is an update to a statement that we had that was put out in 2012 that talked about evaluation and management of neurodevelopmental outcomes. And since then, there's been a whole decade of growth, both in our cardiac clinical programs, but also research programs to improve care. And so this would be a nice place to look. And I'm going to talk about two things that are raised in this article. Back to this idea of risk. In the article, they talk about factors that are shown on the left there that increase risk of developmental concerns. Okay. I want to specifically highlight parental psychological distress. When I first looked at this, I got quite irritated because to me that sounded like blaming parents. But when you look into it more and we understand that parents frequently experience quite significant trauma, they will report mood and anxiety disorders, and they will report severe distress when they have a child with a complex medical condition. Then I think this turns into something that falls into the area of we can do something about this. Parents need care too. Well, parents are important for healthy child development. And this is really my plug for parents to seek your own health care, to look after your own needs, and to recognize that you are not alone in some of these areas of distress when you have a child with a complex medical condition. On the other side of this slide, when we talk about prevention or mitigating strategy, the neuroprotective strategies, that's the medical system's job. That's the care before birth, what the specific surgical procedures might be, how we manage within the hospital, and so on. The interventions, however, are a little bit later on for that early recognition, thinking about the therapies, avoiding the pitfalls where we don't address emerging issues. And in this paper, there's this diagram here which talks about our risk categories. And these two categories of risk that I are really talking about children that are very ill as young infants. This category here, when we talk about risk category 3, those are children who have less severe course specifically related to the heart, but may have other conditions that increase the risk of development concerns. So for those of you that are more interested in the detail, there's many specifics that fall within both this diagram as well as in the larger paper. And so finally, I want to just end by mentioning a few takeaways. First off, development and learning issues are common. Early recognition and intervention is important, and we really do need to avoid the pitfall of wait and see. Parental well-being matters, and I hope to give you permission to look after yourselves. That is good for your children. And please limit screen time. Please sustain habits that may be very necessary when in hospital. Try not to sustain those when the children go home. I will end there because this is a recorded session. You're not able to ask me questions directly. My email is on the screen, and I am happy to take an email question from parents who have viewed this session. Thank you so much.
Thank you for joining us. If you want to learn more about neurodevelopment and mental health and congenital heart disease, please subscribe to our YouTube channel and follow us on Instagram. We are called Strong Hearts, Growing Minds. In the post section of the YouTube channel, you can also find handouts on various topics, while our Instagram account will keep you updated on new upcoming workshops.